Welcome back to another amazing episode of Coffee with Alice. This is Coffee. That is Dr. Alice. You already know who I am. Doctor, how are you?
I'm excellent.
Good. I'm great. Thanks for asking. The last time we spoke, we were talking about the gut. We were talking about, getting out of your rut by fixing your gut. The first episode, we talked about the structures of the gut. When we talk about the gut, you called me a glorified worm. I appreciate that. Mm-hmm. I've been called worse. And we talked about some of the symptoms and tells that will let you know that your gut is starting to be affected. So today we're going to talk about solutions. There's a lot to get into, but we're going to keep it simple and kind of short for you, for the audience. Doc, where would someone start if they wanted to get on a gut rebuilding path?
Well, it depends. But the way that we kind of approach it here at Stark is that usually we will actually run a food sensitivity panel right off the bat after their initial intake.
That's something I had to on my docket to talk to you about. Tell me a little bit more about the food sensitivity panel, because you hear a lot of chatter about that sort of test. What does that involve?
So it is a blood draw. Now, I want to say right off the bat, it's not the end all be all. Okay. By the way, now if I would see more sick patients, then I would perhaps be a little bit more aggressive in doing something initially called the autoimmune paleo diet. That one is a very researched and very effective diet to try to reduce the inflammation in the gut. But since our patients aren't that pathological, most of them coming to us will not have too many gut complaints. Mm-hmm. So we would run, of course, something called, like a company that we've been using for a very long time is Meridian Valleys. And they're looking at IgG4 and IgE. So those are two different parts of the immune system that we're testing for immune reactivity towards, foods. So IgE is anaphylactic. Like right off the bat from a very young age.
Right, like peanuts.
Peanuts or shellfish or something like that. Right. Like your throat closes up, like it's actually life-threatening. So patients will definitely, already know that. But the other part of it is IgG, which is a sensitivity. So people kind of interchange those things. They're two very different things. So sensitivity is much more low grade. It's not as obvious. Mm-hmm. So it can show up as gut symptoms, but it can also show up as joint pain. It can show up as skin manifestations like eczema or hives or acne. Fatigue, sleep disturbances. Other things. I think schizophrenia is kind of part of that sometimes too. And
last time you talked about, your thyroid and your eyebrows starting to fall out.
Yeah.
That unibrow turning into a two-brow.
Right. So that is a little bit more specific way of finding potential food triggers that can, whatever that pisses off your gut. And then we eliminate those for about 2 months and then reintroduce it one at a time. Now, during this time of elimination, so we're removing the triggers. So we identify what the trigger is. Now, by the way, we've run hundreds of these tests in the past 3.5 years. The top 3 offenders are dairy, eggs, and gluten.
So let's say, for example, you test for you're sensitive to all 3. You're gluten sensitive, you're dairy sensitive, and you're egg sensitive. Mm-hmm. So do you pull all 3 triggers out?
Yep, I pull all 3 out because you don't know if it's a sensitivity, an IgG reaction sensitivity, or if the person has eaten it way too much on a regular basis over a long period of time. Mm-hmm. So that is something that I've done to myself in regards to eggs. So I used to eat like 5 eggs a day for 10 years. Now, these are the most blessed eggs that can come out of a chicken's butt, by the way. Like pasture-raised, organic.
I don't think that's where they come out of, but I'm not a doctor. You're the doctor. This is just coffee.
I'm not a veterinarian. Okay. So anyway, those were, again, the cleanest eggs you could possibly get. After about 10 years, I started to actually get fatigue in the morning. And it didn't matter if I slept 9 hours the night before. I would wake up, have my 5 eggs, fall right back to sleep. I would have coffee, fall right back to sleep. Spoke to one of my mentors in med school, and he was like, what are you eating for like how much and for how long? I told him 5 eggs a day for 10 years. He's like, no, you can't.
10
do that.
years.
Yeah,
That's like 50 eggs.
Yeah, it's a lot. It's a lot.
Not a mathematician either.
No, not. So, I took the eggs out. Didn't fall asleep in the morning anymore. So I thought to myself, maybe I could like eat it at night, help me sleep.
Yeah.
So helped me sleep. Problem is, then I started to actually develop eczema. So that again, tried to identify all other kind of potential triggers for the eczema. Realized, oh wait, I'm still eating the eggs. Took the eggs out, eczema went away.
Okay, so you're before I cut you off earlier, you're saying you pulled out the triggers. That makes me think that you're going to put something else in its place.
Yes.
So go on about that.
So the next part is repopulating. Now,
repopulating, and the gut is kind of this ecosystem, right? So what are you repopulating it with?
Depends. So I do encourage patients to eat fermented foods as best as they can, as long as they don't have any sort of histamine intolerance.
An example would be
sauerkraut, kimchi.
Okay.
Pickles, any sort of fermented foods. Traditionally, we humans have eaten lots of fermented foods in many different cultures.
What about fermented grapes?
That's kind of part of it. As long as it's not like 10 glasses or a whole bottle a night.
That's right. So why eat those fermented? What are they providing?
They're providing lots of great little bugs. So bacteria, lactobacillus species. So you can help repopulate like that. Oh, yogurt is the other one. Now, if you're dairy sensitive, they have lots of other milk alternatives. Coconut yogurt's a great one. They have almond milk. They have oat milk. They have all sorts. So I encourage having that at least every day. Now, the Western population does not like eating fermented foods for the most part.
Right.
So this is where we would have to introduce, of course, probiotics. But I give my patients the option. Right. Now, what type of probiotic? This is where things get a little complicated.
That's a complicated thing. It's like walking to a pet store and asking for a dog, right? There's so many different strains and breeds of probiotic. So where would you start, right? So do you start it based on what bugs they need? Based on blood work?
So no, I actually don't do blood work. You don't do blood work for what strains you essentially need. You do stool testing. Now, I personally do not do too much stool testing unless I'm like looking for parasites. But that's something else. For the most part, you want to rotate between the different probiotics. Now, there are, of course, the spore-based probiotics that are actually shelf-stable. They survive the acidic environment of the gut. Okay. So those Megaspore is an amazing company, so we've been using them a lot as well. But if I have a female patient who has a lot of UTIs or yeast infections, and I'm going to choose a different kind of strain. For that one, it's the rhamnosus and a few other things too, reuteri, L. reuteri as well. But it really depends on the patient.
I can't keep Megaspore in stock, by the way. I mean, like people love that. I mean, is that that's not the strain, that's the company, but so
that's a spore-based one.
That's a bacillus.
Yeah, that's a bacillus species. They're an amazing company. But what's great is that, again, they're shelf stable. We don't actually have to worry about refrigerating a lot of these other probiotics.
When someone thinks gut, after a couple of word associations, they come up to fiber. So, how do you determine how much fiber someone needs and what sources they should be choosing to make up that number?
So the issue with fiber, by the way, is complicated. There are some people who do not do well with it.
What is it not complicated with you, Dr. Ellis?
Listen, the human body is very complicated.
Not me.
So most Westerners do not eat enough fiber. Now, there is a debate whether or not fiber is good for you anyway.
I'm sensing some hostility towards the West here.
No.
But that's okay.
So some people do not do well with fiber. We have some coaches who ate the Pegan bar and had a very horrible time from eating those extremely high fiber bars. But whenever I see that, I'm thinking, okay, the fiber is probably feeding some bad gut bacteria that's causing the bloating, the gas, and the cramping, the discomfort. If patients have like really, really, really bad, like what we call small dense LDL, that's like really, really bad cholesterol, I'm going to encourage more of that. But there's many different types of fibers. We encourage patients to eat different types. You're going to find them in berries. You will find them in artichoke. You will find them in chia seeds, flax seeds. So it really depends on what the patients tolerate.
Is there speaking of tolerate, is there such a thing as too much too soon, too quickly?
Oh yeah.
Where you just
No,
you just explode.
Yeah, you've got to slowly build up with fiber.
So where do you set the recommendation at, or is again I assume that depends, but where do you kind of hover in the recommendation for male or female?
Males, according to, I guess, the recommendation is they're supposed to get about 37 grams of fiber a day.
Okay.
Females, about 25 to 27 grams.
Okay, so about 10 grams less.
Yeah. Now, just to give you an idea of how little fiber is in certain foods, 1 tablespoon of chia seeds will have, I think, 4 to 5 grams only of fiber. Okay. Broccoli, I think an entire cup is only 2 to 3 or 4 grams. It really depends. Avocados actually are another great source of fiber.
Yeah, really. Mm-hmm. So is that implying that a fiber supplementation is just generally going to be needed, or no?
Yeah, I would suggest it on top of whole foods as well.
Okay.
Yeah.
Now at Stark, we routinely put in, or the student gets their fiber, and we add it to their to a shake.
Yeah, sometimes if they're really bad about taking the fiber on their own.
Yeah,
on daily basis.
and there's this this anabolic post-workout window that people talk about, and they say you should avoid fiber because it slows down this or that. But what we know about the anabolic window is just so large.
Yeah.
And getting in the fiber in the long term is going to be so much more important than not getting the fiber in. Mm-hmm. And just for the sake of not slowing down that post-workout shake. So that's an alternative, is putting in a smoothie or in a shake, right?
Yeah, it is. Before we even go to fiber, by the way, we should discuss, of course, the kill.
The kill?
Oh, yes, the kill.
You mean like...
So there are some bad gut bugs that you have to go in and potentially kill.
With like antibiotics?
It can be for some people, but we tend to like to use, at least here at Stark, like a broad spectrum antimicrobial botanical.
Ooh, say that again one more time, because that's a really sexy...
Broad spectrum.
Botanical, so plant-based.
Mm-hmm. Antimicrobial.
Give me what does that actually look like?
So the product that we use a lot is in fact biocidin.
Biocidin. Oh, I know biocidin.
Yeah, so that's used for most commonly here at Stark is going to be used the throat spray.
Speaking of another product I can't keep in stock, that is amazing stuff. I mean, I have an addicted personality, so I'm spraying it all day, every day. My wife's like, it's not Banaka, biocidin throat spray. There's also drops.
The drops are specifically to kill really bad gut bugs. So the C. diff species are something, any of the Clostridium species is what we'll be looking for. And this we identify through organic acid testing. That's what I'm trained to do, to look for. And usually, if you've used a lot of antibiotics in the past, then that C. diff, one of the risks is, in fact, the rise of C. diff, which is something, it can potentially kill you. So now you can have varying, a graded level of infestation. So this is where stuff like a biocidin would come in.
Now, we've covered removal, so removing those triggering foods or food sources. Mm-hmm. We've talked about repopulating. Mm-hmm. I'm sure is there more to the puzzle here?
Replace.
Yeah. So before we get into that, we're going to stop you right there. We're going to leave you on a nail biter right there. So far we're at remove. Now, if someone doesn't have the blood test, so would they start with the big three?
I would start with the big three.
And the big three again are eggs, dairy, gluten. And gluten. We're jiving right there. We're in sync. So removing those three and getting on a rotation of probiotics.
Yeah, so that would be replace.
That's replace, right? So we're going to get into the other stages at a later time. That means get out of your rut, fix your gut. We'll have a part 3. See you guys real soon. Thank you, Dr. Alice.